Hello, I'm Dr. Leonard Karadimas. I'm an orthopedic knee surgeon in Port Huron, Michigan, practicing at Advanced Orthopedics. And today I want to show you a live surgery that I have done of an all arthroscopic, all inside anterior cruciate ligament reconstruction. This is the inside of the knee through the scope. And at this point, I've actually taken down the torn ligament and I've drilled a tunnel. That's actually a tunnel that we're going to slide the new reconstructed graft through. The ACL attaches the femur to the tibia and gives you some stability in the knee. Very often, you've probably heard of people that have torn their anterior cruciate ligament. Once that ligament tears, it cannot be repaired. It needs to be reconstructed or rebuilt. And this is typically done by using a cadaver graft, a tendon that we borrowed from somebody who doesn't need it any longer. So in this particular surgery, it's being done arthroscopically. So there's a small camera in the joint. There's some fluid being run through the joint. I've removed the torn ligament. I've created a tunnel. Now this is the tibial tunnel. This is going to be a tunnel I'm going to create in the bone on the top part of the tibia for a new graft to go through. This is an all-inside technique. So traditionally you would make incisions on the outside of the knee and drill tunnels. This is a technique where I'm actually drilling tunnels from the inside of the knee out. So I'm sliding instruments to drill the tunnel through small little poke holes in the knee and creating the tunnels inside the knee so there are no incisions made on the outside skin or drilling tunnels through the bone. So here's my all inside retro drill, and I'm positioning it now, picking the right spot I think the graft should go through. You can see the brown area at the bottom there was where the old ACL attached to, and that's obviously torn and now gone. So how do we do that? How do we drill a tunnel from the inside of the knee out? Well, there's a small guide wire that comes through a very small poke hole, only a few millimeters wide, through the skin into the bone, and this is sort of a guide. And there it is right now, poking through the bone. That twists right into the reamer. Then you spin the reamer the other way, and that will actually create a tunnel or a hole in the bone that the graft will ultimately go into. You pull that down to a certain depth. Typically that's going to be 30 millimeters. All that snow you see in there is just some bone that we've ground out of that tunnel. So we reattached our reamer. Obviously, this takes a little finesse, so it takes a little bit of pulling things and making sure you're in the right spot. Just making sure we're disengaged here, so that pops out, and now I can remove my retro reamer. I've already drilled the top tunnel, the femoral tunnel. That's where that stitch is going through. So there's a pin I'm putting through there. It's a guide pin, I call it. And then a hemostat to hold on to it. You obviously are using very small instruments and through the outside, and you want to make sure that they're held in place on the inside. There's a tunnel. There's our tunnel we've created that the graft is going to go into. So this is again an all inside, all arthroscopic ACL reconstruction. A nifty modern way to reconstruct, rebuild the anterior cruciate ligament once it's torn. So at this point, what we want to do is insert a stitch into that tunnel area, and that's what I'm doing here. We call these shuttle stitches. That's how we shuttle the graft into the area that we want to reattach it to. Since we're working through small little poke holes on the outside of the knee. There's my stitch. I'm going to pull that out. You can see that stitch there is a white stitch. I mean, sometimes it helps to have different color stitches so you know the blue stitches for the femoral tunnel on top and the white ones for the tibial tunnel. keep track of things since you don't have any incisions now. These stitches are going through small little poke holes, so we want to keep track of what's what. So there's my femoral tunnel on top. I've created that all inside, and my tibial tunnel on the bottom, all inside. So my tunnels are prepared now. That's how I want to reattach the tendon. How do you reattach the tendon? How do you reattach the graft? You make these tunnels. Now I'm sliding the graft into place here. The top part of the graft is held into place by a small metallic button. It's called an endo button. So there's my tunnel. There's my endo button going through the tunnel. That my button will pop through the hole I've made, small hole, 2 millimeters, pops through there, flips on the other side, on the cortical side, the hard side of the bone, and once that's flipped into place, that's going to lock it in position. And I'm just checking to make sure I can feel it locked. Once I'm sure that that button has locked into place, then through the small poke holes on the outside of the knee, we're going to slide our graft through. And there goes our graft. It's an anterior tibialis graft going into that femoral tunnel I've created to a depth I've predetermined. I determined how deep that tunnel was, and you can see I've marked it off on my graft there with that small black mark. We do have stitches through that graft, obviously, to hold it into place. All inside anterior cruciate ligament reconstruction. Now I'm sliding the graft through the bottom tibial tunnel, again with my shuttle stitches. We've put what we call whip stitches through that tendon to really stabilize it and secure it. We're just making sure that we're not bunched up anywhere here. There it goes. There it is. That is that is this patient's new anterior cruciate ligament. I'm Dr. Karadimas, orthopedic knee surgeon at Port Huron Hospital, and thank you for watching my all-inside ACL reconstruction.